Hiya, and thanks for joining. I want to share my personal antidepressant withdrawal story with you, what happened, and offer hope to people out there, because I believe whatever your situation and whatever your choice, there is always hope for you out there. So basically, I was on an antidepressant for about 12 years. I was on citalopram, which is an SSRI, and I was on it for several years, and then I decided I wanted to try and come off this medication. Now, for my story, I did it incorrectly. I did it too fast. I came off last year. It was about April 2023, and I came off stupidly, I'll be honest, over about 4 to 6 weeks, which I believe was old guidance. So I did it completely wrong and too quick, and things started to go downhill quite quickly. I went into what I strongly believe is withdrawal, which is now being recognised in the healthcare profession. So I decided to reinstate a couple of months after. It was about end of June 2023. I reinstated the citalopram, and again I made another mistake. I'd had a couple of doses. I'd gone out one evening and I ended up having a few drinks, and I absolutely learned the interaction when you were starting a medication such as an SSRI. Absolutely strongly advised not to drink during that time. I did, and what I believe had quite a severe adverse reaction. So my mood went extremely low, like nothing I've ever experienced before. I panicked. So after 3 doses of the reinstatement, I just stopped, came off. So this was end of June, beginning of July. I tried to stay off for another couple of weeks, but I kind of realised that, I'd gone off too quickly in the first place, over about a month, and then I'd gone back on and off. And by that time, my brain was completely muddled. So I did everything wrong. It was my own fault. So in July 2023, I properly then reinstated at a therapeutic dose of 20 milligrams of citalopram. And then I stabilised for a couple of weeks on that dose and decided then I would try a much slower taper. It wasn't slow enough. It was from July to November 2023. And I'm just going to let my dog in. She's going to bark. So, yeah, I did a slower taper then over about 4 months, which again was far too quick. I took my last dose in November last year, 2023. I tried to stay off the antidepressant, but what I noticed as the weeks went by, and it probably got to about 6 weeks, so by that time we were into maybe January, February of this year, 2024, when I was in what I strongly believe was severe antidepressant withdrawal, because I tapered too quickly. I'd done it all wrong. I'd also tried coming off the antidepressant at a wrong time in my life personally. So there was a big change in my life. So that was not going to go for me either. So again, my advice to you is, if you're going to try and get off your medication, obviously under medical supervision, and if that's what's right for you, but it's always best to do it at a time in your life when perhaps you're not going through any significant life changes. Of course, life will never be perfect and there'll always be stressors, but I did it when there was a huge life change. So I'd set myself up for failure. So yeah, it didn't work. So I tried my best to stay off the medication, and I was in withdrawal and I couldn't do it. So I went through a couple of other antidepressants. I reinstated the initial medication I was on, which was citalopram. That didn't stabilise me. I think I may have not given it long enough. I think I gave it about 4 weeks, and I didn't feel like I was where I was at my baseline, so I gave up. I tried another medication. I tried duloxetine, and I'll talk about these medication experiences in another video, but I tried duloxetine for about a week, and again I'll go into reasons why I didn't stay on that in another video. But then I ultimately decided to try fluoxetine, formerly known as Prozac. So I went on to fluoxetine, and I did stabilise quite recently, really. I've been on it for nearly 3 months, and I would say at about probably 8 weeks, certainly noticed an improvement, and by 10 weeks I would say almost back at baseline. And now as I stand, I would consider myself where I was before I came off my antidepressant and did it completely wrong. So reinstatement was successful for me, and it often can be. So it really is an individual choice for you. During my 4-month taper, which was too quick, and the time that I tried to stay off the antidepressant, I did lots of things wrong. I was really fixated on forums. I read a lot of horror stories on different sites I'd found on the internet. So all these things, you know, apart from the quick taper, I had really set myself up to fail. So when I try again, which I'm going to, probably in a year or 2 years' time, and I'm going to pick the right time to do it. I'm going to do it much slower. Probably for me personally, probably going to be looking at about a 2-year taper. But while I'm doing my taper, I'm going to do it under medical supervision. I've got the new guidelines, deprescribing Maudsley guidelines to follow, and I'm going to do it patient led by myself under medical supervision. I'm going to listen to my body and just take it much slower. So I'm not going to set any kind of deadline on when I need to be off. I'll be looking at, as I say, about 2 years. If it takes longer, it takes longer. If it takes a little bit less, it takes a little bit less. But what I learned from when I did it over 4 months is I was really I was very actively involved on the forums. I wasn't necessarily commenting, but I was reading lots of horror stories, and I was really set in the mindset of I need to get off this medication, and I need to do it by this time. So I rushed through it, and I didn't really allow my body to get used to each drop of the medication. And also what I think I need to recognise across this community as well is on a lot of these medications, such as antidepressants and benzodiazepines, such as Valium. And if you've been on them for a long time, like I was, over a decade, over 10 years, a lot of normal anxiety is masked. So I refer to it as like a blanket around kind of life. So I guess it's learning how to sit with anxiety again. And I'm going to take that time now, before I decide to taper again, to kind of relearn them skills. So this is part 1. I'm going to do another video which will go into a little bit more detail of the medications I tried before I settled back on fluoxetine. So I reinstated a different antidepressant, but I stabilised and it was fine. But I just want to end this video by saying as well that whatever path you choose, that's okay. So, you know, what's clinically right for one person wouldn't be for another. I personally want to come off my antidepressant. The reason why I went on it has changed, so that's my reason. But it's also okay if somebody wants to stay on their medication as well. And I think, you know, trying to move away from kind of one way thinking, you can still live a functional life should you decide to stay on your medication. I'm back on an antidepressant. I certainly don't feel like a zombie. What I will discuss in another video is my pre-medicated self compared to now. So there are slight, perhaps subtle changes, nothing extreme in personality. As I say, I'm definitely not a zombie. I'm still level-headed, coherent, etc. But I can notice a slight difference now, having been off the medication, been on it for a long time, and back on. I do notice that change of how it affects you. As I say, the best way I can describe it is it feels like the blanket is kind of back, that kind of layer of protection from life. And again, that's why I want to reinforce that it is okay if, for you, staying on your medication, if that's been agreed by your doctor and that's what you want for yourself, then that's fine too. Because, you know, life, I feel, is a lot harder than it was, say, even 10 years ago, with social media, and kind of everything that's going on in the world. I think life is a lot harder. And I don't think, you know, we have kind of caught up with that. So there is kind of a role for medication in that, you know, if it makes your life easier and then it's help treating a mental health disorder, then that's fine as well. So there's no right or wrong. It's just whatever suits you. But yeah, so that was my story. So part 2, I will share a little bit more about when I reinstated the original medication. I'll share a little bit about my experience of duloxetine, and then a little bit about fluoxetine, which is what I'm on now. But yeah, if you end up reinstating your medication and then deciding to do it at a different time in your life, then that's okay as well. So yeah. And a big thing I learned throughout all this process is really trying to stay away from horror stories. Obviously, it's important we recognise, you know, the antidepressant withdrawal is a real thing. I went through it, and the symptoms that I had, I'll go through in part 2 of my withdrawal story. But it's important to surround yourself with positive people, hope that, you know, whichever path you choose, you can live a happy, productive life, and there's hope there for everybody. So thanks for watching this video, and I look forward to doing a part 2 with you soon, which will just go into a little bit more detail, but thanks again. Cheers.